Hello everyone, this is Dr. Farhang Far and I want to acknowledge you for taking time to show up for this presentation today. I love helping people lose weight and become healthy and fit. I was fed up with the standard medical instruction of just eat less and exercise more. So I created Easy Medical Weight Loss to provide my patient with a step-by-step customized weight loss roadmap to help them achieve their weight loss goals. Our program is easy to follow and guaranteed to produce results. I have treated many of my patients with type 2 diabetes, hypertension, sleep apnea, and other chronic conditions related to obesity. I became interested in treatment of obesity after seeing devastating effect of obesity on many of my patients and not being able to help them other than the standard admonition of eat less and exercise more. I wanted to give my patient tools and techniques to help them improve their nutrition and health. Today I want to talk to you about specific ways and means of achieving better nutrition, health, and motivate you to take the first step on your weight loss journey. So with that in mind, let's get started with our presentation. Standard American diet is what I call SAD diet. The standard American diet contains too much sugar, salt, fat, hormones, pesticides, additives, genetically modified fruits and vegetables that are detrimental to our long-term health, while contributing to many of the chronic medical conditions that are plaguing our nation today. The standard American diet contains too little beneficial cancer-fighting ingredients such as omega-3 fatty acids, which are anti-inflammatory and have many other beneficial effects. There are too few cancer-preventing fiber, magnesium, vitamins B and D, and other beneficial nutrients. Long-term consumption of a standard American diet will lead to overconsumption of empty calories, resulting in nutritional deficiency, metabolic syndrome, obesity, heart disease, diabetes, stroke, cancer, and dementia. In one study, 63% of the food consumed in the United States contained processed food loaded with fat, sugar, salt, and refined grains. Only about 12% of the food came from wholesome, nutritious plant food containing vegetables, fruits, legumes, nuts, seeds, and whole grains. As you can see, one reason that we are in such a dismal situation today is our food supplies are being controlled by a small group of companies that primarily concerned with increasing their profit. These companies are manipulating our food supplies purchased by consumers in a way that is causing people to eat and crave more unhealthy foods. Fortunately, there's been tremendous consumer demand for clean, healthy, and nutritious foods over the past few years. There's been a significant increased level of organic and homegrown food that is consumed, causing improvement in our overall diet. However, poverty still prevents some significant portion of our population from escaping the adverse effect of poor diet and benefiting from this new food revolution. So with that background, let us look at the changes to our dietary patterns over the past 50 years. 50 years ago, we did not even have fructose corn syrup, which is chemical substance produced in a lab and added to many of the food in order to increase their shelf life as well as enhance flavor and palatability. High fructose corn syrups are cheap and sweeter than regular sugar, which makes them perfect food additive for increasing profit for the food companies. As far as the sugar is concerned, back in 1800, people consumed about 10 pounds of sugar per day per person, but in 2000, sugar consumption is increased to about 150 to 180 pounds per person per year. This is causing a great deal of medical problems for us, such as increased diabetes and obesity. There's been increased level of high fructose corn syrup consumption, which is linked to insulin-resistant diabetes, elevated LDL or so-called bad cholesterol, increased triglycerides, and metabolic syndrome. The number one source of the calories consumed in the United States is high fructose corn syrup. And this is causing a lot of problems, especially for the young people in this country. High consumption of fructose corn syrup is detrimental to our health. Fructose is turned into free fatty acid and very low density lipoproteins and triglyceride, which then gets stored as fat in the liver and other organs. These free fatty acids accumulate as fat droplets in the liver and skeletal muscle tissue, causing insulin resistant and non-alcoholic fatty liver disease. Insulin resistant, which can progress into metabolic syndrome and type 2 diabetes. Unfortunately, detecting high fructose corn syrup in the food is not always easy, as there are many products we do not even suspect containing high fructose corn syrup, including condiments, supplements, medications, vitamins, and other consumer products. This is detrimental to our health and causing a lot of chronic medical condition. I recommend my patient to avoid white bread, pasta, sweet, soda, juice, or any food that contains too much sugar. I also recommend avoiding all artificial sweeteners, only recommending the following sweeteners in small quantities or not at all. Stevia is an herb that is sweet and used instead of sugar and helps people trying to lose weight and need to have their sweet tooth satisfied on occasional basis. Also, pure cane sugar and or organic honey, if you can find it in moderation, can be helpful. Again, I would recommend avoiding all artificial sweeteners, as they have been shown to be neurotoxins and increase obesity significantly. I would also recommend avoiding sweeteners such as agave that are supposed to be healthy but in practice are just as harmful as regular sugar. Fibers are another important part of healthy diet. There are a good deal of health benefit in regular consumption of dietary fibers. Average American diet contains less than 15 grams of dietary fiber. Benefits of increasing dietary fibers include slowing down sugar absorption in gastrointestinal tract and prevention of colon cancer. Dietary fibers can also make us feel full, so we're less likely to overeat and become obese. Dietary fiber also binds the cholesterol in our gastrointestinal tract, reducing cholesterol and coronary artery disease. There are several excellent diets out there, such as DASH and Mediterranean diet, that I recommend to my patient for weight loss and wellness. The whole idea about Mediterranean diet is to shift your diet from high-calorie, low-nutritious food to a diet that is high in nutrition and low in empty calories. In this diet, there is an abundance of vegetables, seeds, beans, legumes, which are all beneficial to our health. There is also emphasis on healthy dietary oils such as avocado and olive oil. that are rich in omega-3 fatty acids. There is also a small amount of lean animal proteins, fish, seafood, while avoiding excess red meat consumption. Mediterranean diet is also rich in fruits and vegetables that are loaded with antioxidants, vitamins, and other nutrients. Mediterranean diet stresses fresh fruit, while avoiding excess processed food. So if you find this presentation helpful, please stop by our website and ask for a free consultation to see how we can help you achieve your weight loss goals. Thank you and have a great day. Bye-bye.